Yasmin, would you like to begin?
Yeah, of course. So I'll start off with, I guess, an agenda for what we're going to do today. So we'll start off by telling you guys a bit about Newcastle, about the course, some information to help you structure your why Newcastle answer, a bit of like a day in the life of a Newcastle student as well. And then we'll move on to the second half of the session, which will be interactive. So we've got some practice questions for you guys, kind of in Newcastle interview style. And then we'll have cameras on and you guys can have a go, and then we'll give you guys some model answers. So, yeah, should we get started?
Yeah, let me just introduce myself. My name's Hassan. I'm a first year dental student at Newcastle, and I applied to medicine universities as well as Glasgow for dentistry, Manchester for dentistry, and Newcastle for dentistry. Okay, so start off with the core structure. So Newcastle likes to load you with content in the first 2 years. And what they do is they give you all the core biomedical sciences. They build the foundations on all the knowledge, and then they like to make you independent over the years. So once you get into the third and fourth year, you're starting to deal with much more patients. You're having much more contact. You're on clinics for usually half the day, and then you're on teaching sessions for the rest of the half. And then you get to build this really good rapport with patients. And then finally, in your fifth year, this is when you're in your final clinical year, and you're going to be dealing with different patients within different clinics, so oral surgery, uh, different orthodontic clinics. So this is like really where you can develop your clinical skills so you're ready for practice. And one thing that's really good about Newcastle is we're one of the only universities that still do oral surgery as clinical placement. That's something that's really unique. So that's a reason why everyone should come to Newcastle.
So, in terms of the interview itself, it's a panel interview on Zoom. It's about 20 minutes, and there's two interviewers. And this is taken from the website itself. So, what they're assessing you on is preparation and motivation for dental school. So, thinking about things like why dentistry, not medicine, effective learning skills. So, how you learn, there's a big emphasis on independent learning at Newcastle. So, they want to see that you're able to learn that way and how it's effective for you. Teamworking, personal qualities, so things like communication, empathy, resilience, interpersonal and communication skills, and then empathy, integrity, and professionalism.
Okay, so now I'll walk through what a day in the life of first year dental student is. So I've included 2 weeks. So one is from the beginning of September that me and Yasmin had. So this consisted of lots of lectures, as you can see on Monday. We had four back-to-back lectures. It also had we had a tutor meeting. So at Newcastle, you're assigned a personal tutor, which usually checks up on you before exams, before the holidays, and also after exams, just to make sure your progress is going well. You're not making too many like missed attendances. We also cover modules like cell biology, cell physiology, and then also anatomy, which is very heavy within first year. And then in the second timetable, we could see that it's quite a lot of clinical shadowing. So all these blocks over here in the dark blue are where we're shadowing fourth year dentists. And this is something that's really good with Newcastle, where they give you early clinical exposure and you're able to see lots of different patient interactions and see how communication is really important and a very vital aspect of dentistry. And you can see there's also lots of free time within the second timetable. This is where your independent study comes into place.
Okay, so let's talk a bit about why Newcastle in terms of the actual course for dentistry. So, first, we've got new high-tech clinical simulation unit and new digital equipment. So, recently there's been like a big renovation. They spent around £5.5 million into this. So there's new dental simulation units and then new digital equipment like mouth scanners, 3D printers. And this is really important because dentistry is so ever evolving. And it's so important that you're able to keep up to date with the new technology so that as a graduate, you'll be ready for the future of dentistry. So that's really good. We've mentioned this, but yeah, a lot of independent study. So in year one, it's around 70% independent. And I think it's really important if you actually mention why this suits you in your Why Newcastle answer, if you're asked it. so that they know that it's already something that works for you. Then you've got early clinical exposure. So, as you saw from the timetable that Hassan showed you, we are observing procedures and shadowing senior students from year one, and then you actually start seeing your own patients from third year. And then we've got integrated course on professionalism and personal professional development. And this runs throughout all stages, year one to year five. So this is really important because it makes sure that you're remaining in line with the GDC principles throughout your career as a dental student, and then you're able to then carry those on with you when you actually become a graduate dentist. And then finally, you get to work alongside other professionals. So it's one of the largest integrated teaching and hospital complexes. So as a dental student, you're lucky enough to be able to work alongside other dental nurses, other dentists, because of the close integration with the dental hospital and the RVI as well. So that is something that can be really good for you to gain those experiences as a student.
One thing that I like to add on as well is that at Newcastle, you stay at the same dental hospital for the 5 years. So you're not able to, you don't need to like move around, move cities, and go on like different places for work placements. You're staying in that same place. So it provides that good like comfort and like security in terms of like accommodation as well.
Amazing. So now we'll talk a bit about why the uni itself. So a lot of outreach goes on at Newcastle. So they love to help and give back to the community and improve access to dentistry. So we can do this through a number of ways. You can join Brush Up with, which is a volunteering society. They go to schools and help give oral hygiene advice, make kids a bit more exposed to the dentist and kind of what it's like to help reduce dental anxiety in children. And then there's also the NHS Melissa Bus, which goes around and helps to promote access to dentistry around Newcastle. And then we've got things that help with mental health and student well-being. So, like Hassan mentioned, you get a personal tutor throughout your studies. And then in addition to this, you actually get a peer mentor in year one. So it's someone from year two who can help kind of bridge the gap between school and university and really helps kind of support you in that way. And then you've got student well-being. So Newcastle loves to emphasize student well-being and like mental health. So there's so many people that can help in that regard, especially for dentistry because it's such a stressful degree and career. So having that in place is really important. And then you've got societies. So I really recommend you go onto the Newcastle website and you have a look at the societies on offer. I recommend that you go and you see find three different societies that you can mention in your answer. So pick a volunteering society to show that you want to give back to the community. So you can mention Brush Up. A sports society because, as you all know, dentistry is very physically and also emotionally demanding. So having a sport you can do along the side can really help maybe ease the back pain or the shoulder pain. And then a society to meet new people, so something that you're interested in alongside dentistry, and that can really help with work-life balance because dentistry is so stressful. And then you've got the city. So it's a very friendly city, and this is really good because it means that probably most of the patients that you're going to be dealing with will be friendly, or the staff are, of course. It's very affordable, which for a student can be quite a big factor when choosing a university. It's quite a diverse city as well, so this can be really good when you're treating patients. If you've got a lot of diversity, it means you'll definitely get a range of cases, which means you'll get a range of experiences, so that when you do graduate as a dentist, it means that you're more competent and more confident in your ability to practice. And then we've got a lot of culture, so museums and theatres, and then nature, which is good to kind of relax and de-stress because we're so close to the countryside.
Okay, I'll just answer one question that we've got in the chat regarding the oral surgery and maxillofacial placement. So I was speaking to one of the clinicians actually, and they said that within fifth year, Newcastle is one of the only universities where you actually go on, because it's a hospital, you're dealing with so many different cases. You can experience emergency cases as well, and you can go on shadow maxillofacial surgery, which is something quite unique because not every university has like a hospital as such centered within their within that city for like in regards with maxillofacial surgery. I hope that clears everything up.
And any other questions, feel free to do the same and just put them in the chat. And we'll
You can
also
put
have
them in the chat or
one.
like raise your hand as well.
Amazing. And now I just want to touch as well on the research aspect that you can include in a why Newcastle answer and also just a reason why you would want to come to Newcastle. So a lot of research goes on at Newcastle University. And again, I really recommend you go on the website and actually have a look to see, because this is just like some snippets to see if there's something that really interests you. So I've got from here, so there's a lot of research going on periodontal disease. So they've got how vaping can affect periodontal health, um, and other current research. And we've got some current projects, so clinical trials that are going on at Newcastle to do with dentistry and oral health. And then we've got some research on health economics. And so the head of the school right now is Professor Chris Vinaza, and he is very into health economics and he does a lot of research on that. So I think he's the research lead for these projects. And I really, as well, again, recommend you to go onto YouTube and if you search Mini Medical School Chris Vinaza Dentistry, it should come up and it's like a lecture that he's given online. And I think if you go watch that, first of all, it'll give you, I guess, like a snippet into kind of what Newcastle is like and like the professors and teaching style, I guess, and also just very interesting lecture on dentistry right now. So I really recommend you look that and you can mention that in your interview. And then dental biomaterials, so projects which can be really interesting. So smart ion releasing resin-based composites. And if you just pick one of these that really interests you and mention it in your interview and be like, wow, it's really amazing how they've done this, and something that I would want to do is something like this, and like that shows like really good interest into research and is quite impressive. So yeah.
Following on from that, Zach's asked the question, is it actually students doing research or more graduates? So what we have are professors or like our lecturers, they're doing these research. So you're basically getting taught by people who are at the top of the research table. And there's lots of graduate students as well who are doing masters, PhDs. But being in that environment, being surrounded by so many professionals within that field, I think it's really a really good thing for Newcastle as it's researching in so many different fields.
Something
Okay,
to add
now,
on.
yeah,
Oh,
sorry.
sorry. Just something to add on to that is in the summer as well, there's opportunities where, as a student, during the summers between years, you can get involved in research. Maybe not as like high scale as this, but just like getting involved, which can be really good to help build your experience and your portfolio as well.
I think we've done quite a lot of the talking. Now it's time for everyone else to answer questions, I believe. So who would like to go first?
Should we
This
put
question,
cameras on now for this
yes, please.
section so that because obviously the interview will be fit cameras on a Zoom, so you want to get that practice of coming across as how you're going to say it in the interview.
We have the first two questions. Who would like to have a go?
Oh, no one's answered yet.
Okay, that's fine. Could you open your camera by any chance?
I'm not currently at home, so it's not really the best, I guess, to open
Okay,
my
that's fine.
camera.
You can have a go at the first question. So I'll do it as a proper interview. I'll be part of the panel. I'll ask the question, and you have about 3 minutes to answer the question. Who is part of the dental team, and why is teamwork really important within dentistry?
So, from what I've observed during my work experience, I've seen that there's loads of different members in the dental field. So, the first one obviously is a dentist, and kind of they're basically to do the oral surgery and make sure that the patients come in and leave happy and healthy. The next member would be the dental nurse, and they're there basically to assist the dentist, so part of the 400 dentistry. So, for example, they would be doing dental charting, they would be able to assist with sedation and just kind of offer advice and help the patient try and reduce any anxiety that they feel. The next member of the dental team would be the dental receptionist, and they're such a vital part because without them, you're not able, as a dentist, to see appointments. So, for example, dentists can see up to 20 to 30 patients a day, and the dental receptionist would handle this. So, without them, you're not going to get that smooth clinical workflow. Another member of the dental team would obviously be your dental therapist slash hygienist, and they're there basically for preventative and oral hygiene treatments such as scale and polish, kind of fishing and sealants. And teamwork is so important in dentistry. So I've consistently seen during my experience at both a dental kind of NHS clinic and an oral maxillofacial department surgery, the importance of teamwork. So, for example, a patient came in who was struggling with dental anxiety because they hadn't been to the dentist in over 5 years. And what I was able to see was how the dental nurse and the dentist kind of worked together efficiently, and it kind of made the patient feel a lot more calm. So they asked open-ended questions. They kind of displayed that positive body language between them. I think it's also important to note that when I spoke to the patient afterwards, they were able to kind of communicate to me how they felt a lot more safe and comfortable through this. And then relating onto dentistry, I've kind of realized the importance through teamwork, and I effectively did this during my gap year. So I did Angloville, which was a cultural program, and I had to work within a group of 10 people. And our main goal was to kind of supervise children and help them learn English. And through these experiences, I've seen that teamwork is so vital in dentistry because it ultimately, in the end goal, would promote that patient-centered care, which is so important for patients.
That was a really good answer. It basically ticks every box. So I don't think I have anything to fault there. Do you, Yasmin?
No, that was a really good answer and really good how you linked it to yourself at the end too.
Okay, that's
Thank
good.
you.
Who who would like to have a go at the next question? And then we'll go through mark scheme at the end. I think we'll limit to 2 minutes as well because we do have to try and get through as many questions as possible. So question number two, as a dental student on clinic, who would you, what would you do if a dental nurse gave you instructions that conflicted with what you had been taught? This free interview tutoring, by the way, you won't get this anywhere. To make sure you get the most out of it.
Yeah, even if you're not too sure on the answer, it's better to have a go and then you'll remember kind of the feedback a lot better as well.
Even if you don't want to like do a full answer, you can do bullet points, give ideas about how you tackle the question. I think if you start a conversation going, that'll be the best way to actually discuss it.
I can try having a go, but I'm honestly not really sure how I'd answer it.
That's fine. It's right, you can have a go whenever you're
Um,
ready.
so if a dental nurse gave me instructions that conflicted with what I had been taught, then maybe I would first speak to the dentist, I guess, who was there during the appointment or whatever it was, to understand exactly what the instructions are supposed to be.
Okay.
Don't really know what else for this one.
Before you go to the dentist, how would you deal with the nurse who's asking you to like do something that you haven't been taught? So in that situation, what would you do?
Ask them for more information about the case.
Good. Yeah, you'd understand what the message they're trying to put across. You wouldn't neglect them straight away. You don't want to put them down just because they're a nurse and you're going to become a dentist. You want to uphold their profession as well. Be open to what they're saying. And if it's still confusing you, you always raise it to senior clinician. That's always what we do. So we can go through both answers. So within this question, you have basically you have five main things. You're going to pause and you're going to prioritize patient safety. Okay, you're going to make sure that whatever your procedure you're doing, even if there's any doubt, you're not going to go on with it until you're 100% sure with what you want to do. Okay, you need to understand that you're a student. Okay, and you need to listen to the clinical professionals who are surrounding you. Okay, you are still learning and you might have made a mistake. Make sure that you're respectful within your communication. As I said, that you don't want to put down the nurse just because they have a different idea. And then if still there's some a lack of clarity, raise it with a senior clinician. And then finally, reflect on it. Reflecting within interview answers is really important. And if you don't do it within an answer, your answer's not complete. So make sure you're reflecting every step of the way. And coming back to the question regarding the people within the dental team, I think you mentioned everything. One thing I like to tell all my students is make sure that you remember the patient is the most important part of the team. Without the patient, there won't be a dental team. So try and include that within your answers, and interviewers really like to hear that as well. No worries. Does that make sense for everyone? Or does anyone have any questions regarding that?
I have a question.
Sure.
You said that mentioning the patient because they're the most important part of the dental team.
Yeah.
How would you? Because like for example, in the situation, this is kind of a nurse is giving you an instruction and you don't agree with it. But how would you involve the patient? Because you don't want to involve a patient and like get confuse them or make them feel like there's disagreement between the dental
Yeah.
team because that might make them a bit nervous.
Okay, that's a really good question. So the questions that were asked, they're two separate questions, so they weren't actually combined together. So when you're in the situation with a nurse and the dental student, you wouldn't really involve the patient as it's something that should be decided between the clinician. But I was talking about the first question, which is who's part of the dental team. So like if you think about it, without the patient, you're not going to have a proper dental team. You need to prioritize the patient's wishes, make sure they're comfortable, and the main goal is to prioritize the patient's health.
Okay.
Does that make sense?
Yeah.
Yeah.
Thank
Okay,
you.
perfect. No worries. Okay. So next we have some professionalism questions. Who would like to have a go? Before I reveal the question, I want someone to nominate themselves.
I could have a try.
Okay, perfect. So for the first question, can you have your camera on?
Yeah, sure.
Okay, that'd be great. So
It's blurring me out.
it's fine.
Yeah, okay.
Okay, perfect. So we'll start off. What does professionalism mean to you? And can you give me a time when you have demonstrated professionalism?
Could I please get a moment to think about this?
Yeah, that's right, no worries.
Yeah, okay. So for me, professionalism means, for example, in a dental setting, where we act in a way for the patient's best interest and in a way that our own personal feelings don't get conflicted with what our job is. So, for example, in dentistry, if a patient is being very rude or maybe very dismissive to the dentist, or maybe the dental nurse is showing controversy or they're maybe not being supportive of the dentist's actions, as a dentist and to act in a professional way, what that would mean is that you would put your personal feelings aside and you would act in a way in a respectful way, in a respectful manner, so that you don't disregard their feelings. Because being professional means to be open to everyone else's feelings and how what they think is right. So for me, professionalism means to act in a way which is supportive of others, as well as being able to act in the best way possible for your patients and for others. And an example of when I demonstrated professionalism was during a time, for example, I worked part-time as a lifeguard, and on the pool side, I get asked many different questions, some very, as many other people would say, very obvious questions. Like, for example, I would always be standing by poolside and there would be a clock behind me. And some patients would come and ask, "Oh, what time does my session end? What is the time right now?" So obviously in inside I'm saying how the clock is right behind me, but I would act in a professional manner and I would understand that and I would speak in a way that is professional. So I would always help them understand the correct I would answer the question for them and I would tell them what the time is and I would make sure they understand what's going on. Thank you.
Okay, perfect. So I think you answered the definition really well. You talked about what professionalism means. We'll go over the answer. There's another follow-up question, but I'll go over the proper definition. But I think you covered all aspects. One thing that I'd like to say is you mentioned patients at the swimming pool. So I think I'll just
Did
make
I
a
say
mistake. That's fine.
patience?
Yeah, you said patients.
Oh, I must 'cause I probably got it
That's right. No
mixed up. I
worries.
meant
It's
like
right.
pool users.
Yeah, that's fine. No worries. And then finally, at the end of your answer, so are you aware of the star technique?
Uh, Probably is it like the reflect at the end
Yes.
or to
So
like yeah,
make sure you reflect at the end, but also link it back to dentistry.
related to
So once
dentistry.
we've talked about your professionalism example, okay, then talk about how it's important within dentistry and how without it, dentistry would not be as like functional, if that makes sense. Do you want to
Yeah.
try and highlight the importance as much as possible?
Sh Should I try it?
Yeah, go on.
Oh yeah. So from this, I would understand that in dentistry, professionalism is very important as there are many cases in which a patient might feel very nervous or very unsure of the dental procedure. So as a dentist, being able to calmly and professionally explain to the patient and comfort the patient is very important.
Perfect. That's fine. One thing that I'd say that you did amazing, and this is good for everyone, is if you're unsure at the beginning of a question, there's no harm in taking some like couple of seconds, 10 seconds, 15 seconds in thinking about it. And even saying it to the interviewers, they don't mind at all. They actually like give you bonus marks for saying it so because they know that you're actually going to think about the question rather than just blurting out whatever first thoughts that come into your mind. So always make sure that if you don't understand anything, take your time to answer it because it's better stopping in the beginning rather than in the middle of a sentence to start thinking about stuff.
Sorry, I
Okay,
also have a question for this.
yeah,
Just one
go
more
on.
question. I was looking at my notes, and for the GDC principles, like the number 7 is maintain professional knowledge and skills.
Good.
Do you think that's another thing we should add?
You could mention it. You can talk about how professionalism consists of keeping your professional knowledge up to date. This can be done through CPDs, which is like a legal requirement of dentists. So, like, these are courses that dentists do. Every year, they have a number of hours. So, this can be like online courses, this can be like conferences and teaching sessions. So, you can also mention that as well. But I'll go over like the definition that I like to use after the next question. But we'll cover that. That's a really good point as well.
Thank
Okay, next question. This is a bit of a more common one. I think it might possibly come up in interviews. So you are a first year dental student on clinical shadowing placement. As you arrive at clinic, you notice a fellow student who is about to start treating patients. They appear unsteady, their speech is slightly slurred, and you can clearly smell alcohol on their breath. What would you do? Who would like to have a go at this question?
Is it okay if I could have a go?
Yeah, that's fine.
Yeah.
Yeah,
Could I
whenever you're
just
ready.
could I just have a moment to think?
That's right, no worries.
Thank you. Okay, so from the question, what I understand is there's a situation where a fellow um student has is about to treat a patient and I'm assuming that they might be under the influence of alcohol from the information that I've been given. So the clear issue that stands out to me is that they're about to treat a patient. So this could be going against the pillar of non-maleficence because if they're under the influence of alcohol, they might do they're very likely to do something wrong and which could seriously put the patient in danger. And another issue that stands out to me is professionalism, that this student isn't abiding by GDC principles, the idea of putting the patient first and making sure that, for example, even GDC Principle 9, if they're working under the influence of alcohol and if I can smell alcohol, it's very likely that the patient can also smell alcohol, and this might mean that the patient might lose trust in the profession and might think, and this might add to like someone's dental phobia, for example. How I'd go about this, the first thing would be taking the fellow student away from the patient. I wouldn't address this in front of the patient for obvious reasons. Like I mentioned, you don't want to you don't want the patient to lose trust in the profession. And I would maybe I would go up to the student, ask empathetically, is it okay if can just pull you to the side for a second? And I'd have an open and empathetic conversation with them. Um let them kind of answer. I wouldn't I wouldn't approach this conversation in a way that I'm, assuming something. I would hopefully expect them to say the truth. And if I do feel like they are under the influence of alcohol and they're not being honest about it, first of all, if they are being honest about it, I would tell them that, the harms of this and what could go wrong if the problems with this and what could go wrong if they treated a patient in this condition. And I would again be empathetic. This might just be a mistake that they didn't mean it, and I would never, make them feel like I'm kind of attacking them because I'm also just a dental student. I'm not a tutor to be, coming at them. And if I feel like they're not, acknowledging and they're not, they're just brushing past it and they're just completely denying it, and I feel like they're lying, as a dental student, I would probably take it up with a tutor because I am in a shadowing placement. So I might take it up with a dentist or an academic tutor nearby and maybe express the situation to them as well. And before doing this, I would tell my fellow student that this is what I'm going to do because I don't want them to feel like I'm, trying to snitch on them. I would be open with them about it as well and explain my concerns and my worries. And that's how I would go about it.
Okay, I think that was a really good answer. You covered all the points. You talked about the pillars of ethics. You mentioned lots of GDC principles. You talked about how you take them into a private area where the patients aren't there. You'd be talking to them in a non-judgmental way, very empathetic. You don't want to be accusing them of anything because you're not 100% sure. Try and let them open up before you actually start reporting them. Make sure they have the opportunity to tell the clinician themselves how if they don't, if you still feel like they're going to compromise patient safety and they're not telling the truth, then that's the time where you step in. One thing I'd like to point out is in the beginning, you obviously did take time to actually think about it. That's fine. But then you also mentioned the scenario again. So I'd say do either or because that took up like 45 seconds of your speaking time. And
Okay.
whilst your answer was really good towards the end, I think you could make better use of that time. That makes sense.
Yeah.
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 Because usually either it's going to be displayed in front of you, or even if they say it, they know the situation. So there's no point in you actually repeating it back to them.
Yeah.
Yeah. Okay, that's fine. I think other than that, that was pretty good. Yasmin, anything you'd like to add?
No, that was a really good answer. I will just say one thing is when you said that if they're not complying, that you would escalate it, but you said maybe, maybe just don't say maybe so that you're sure that you would escalate it, if that makes sense.
Okay. Yeah.
One more point that I tell a couple of my students as well is that like whenever you have a case with alcohol, whether it be a dentist or a student, you can always mention at the end to show a bit more empathy that you could maybe offer them because they might have driven into the hospital and you don't want them to drive back because that's going to compromise patient safety, not in the hospital itself, but on the road itself. So you'd offer to actually book a taxi so that way they can get home safely and they're not affecting other people around them.
Okay. Thank you.
No worries. Okay, now we'll go through the marking quickly. So as we said, consider patient safety first, immediate calm action, escalate, support, reflect. So one model conclusion that I thought of was, so I'll say this, although it would be challenging, failing to act would be more unprofessional. As a future dentist, I understand that professionalism means taking responsibility not only for my own behavior, but also for raising concerns when patient safety is at risk. So you can take like parts of this paragraph and like maybe put it in towards the end of your answer, just to show your awareness of the situation. And then coming back to the first question, the definition of professionalism. So what I defined it as is professionalism is about acting in a way that consistently puts patient safety, dignity, and trust at first, because you want to try and make sure that you uphold the patient-dentist relationship, but also the image of the dental profession within the public. Okay, so it involves recognizing your limitations, being honest about mistakes, and reflecting on experiences to improve future practice. And then for the example of when you've used professionalism in your own life, you can use the STAR technique, which involves mentioning situation, task, action, result, and relate back to dentistry. We'll try and make sure to get the slides shared out as well, just so you're not overloading with information. Okay, now these are a couple of questions on personal qualities. Who would like to have a go?
I could try one of them.
Okay, sure. Zach, what would you do if you did not get any offers at the end of this application process?
Okay, let me just put my camera on. Okay,
Thank you very
so
much.
if I want to get any offers at the end of the application process, the first thing is my love for the career of dentistry and my passion for it isn't just going to stop after not getting one offer or offers at the end of this year. I'll take a gap year and then reapply in that year. However, the first thing would be is I would really reflect and try to find out where specifically is it that I went wrong? Was it the UCAT? Was it the grades? Or was it the interview? And wherever it was, then get feedback on them areas and try to improve on them. And that will be one of my tasks for that next year, so the gap year. And by doing that, it'll mean by the time I come to reapplying, I'm more likely to get that offer then because I've understood my mistakes and worked on them. The next thing would be I would continue volunteering and also do my work experience at a dental practice, potentially even seeing if I can get a job at that dental practice. The reason why that's important is because it means that I can continually learn new things about dentistry throughout this year. So by the time I do hopefully get an offer at the end of the gap year, I'm going to have a lot more knowledge about the career, especially going into it. And one last thing I will actually say is I do acknowledge that it is quite difficult to get rejections from universities. As much as I would like to constantly have a good mindset, it can be quite difficult mentally. So I'll ensure that I do things that I enjoy, such as football or go traveling, just to, number one, avoid burnout, which is very common, especially for students, but also just to relieve some of that anxiety and that stress of not getting the application right the first time. So to conclude, they're the main things I do. So first of all, I would look at where my weaknesses were and improve on them. Then I would continue volunteering and also working at the dental practice. And finally, I would do things that I enjoy too, just to relieve some of that stress and avoid burnout.
I think that was a really good answer. You broke it down step by step. You talked about how you'd focus on your different areas of the application. So is it the UCAT? Is it the grades? Is it the interview practice? Is it maybe that you weren't prepared enough for the interview itself? So like you were taking too much stress. You didn't give enough time for the interview. So breaking that apart, trying to dig into email the universities, ask them where you went wrong within your application. There's no harm in like actually asking the universities, and they're happy to help as well. Focus on yourself. So you really really good link to mental health and how you're gonna help improve it. Do like social activities, hang out with friends. I think overall you concluded really well. One thing I'd say is you don't need to summarize it at the end because they've just you've just said it to the interviewers, but that's just the only thing. Yasmin, anything else?
No, yeah, I think that was a really good answer. And I think the most important thing is the reflection. So that was really good.
Yeah. Okay. Um, One thing you could, I think you missed out was personal statement. It's not that important these days, other than like Liverpool or other universities, but just one thing that you could have mentioned as well. Okay, second question, personal qualities. This is something that might come up in interviews as well. It's quite common these days. Who would like to have a go at this? If you don't want to turn your camera on, that's fine, but as long as you can answer the question, I think that'd be good as well.
I can try and answer it.
Okay, that's fine. Shall we again? So other than maintaining work-life balance, what else have you gained from your hobbies outside of school that would be useful in a dental career?
Okay. Well, outside my work, for example, outside my school, I take part in football. So from this, I've learned many things over the many years that I've been playing it. I've learned teamwork skills and I've learned leadership skills and communication skills. With teamwork skills, from my football, I understood the importance of being able to work together as part of a team, especially with my different teammates, in order to have a shared goal to win the match. And I think this is very important in dentistry, especially with having to work as part of a multidisciplinary team, working with dental nurses, technicians, the receptionists to make sure that the whole dental practice is running smoothly. Another thing I learned from my sports, for example, is um, leadership skills. This also links back to teamwork skills with having being able, as a dentist, to be able to lead a team of nurses and different technicians. So this links to my teamwork skills. And another thing I also learned outside was, for example, I take part in my school's student council. And from this, I've learned communication skills. And this is very important in dentistry, especially with having to communicate with different patients and speaking in a way which is professional as well as being able for the patient to understand it with like removing dental jargon and not speaking in a way that the patient doesn't understand. So overall, from my things, for example, from football and the student council, um, I feel teamwork, leadership, and communication skill is also very important in a dental career.
Okay, that was a really good answer. I think you followed the STAR technique, talked about all the different examples, you reflect on it. One thing that could possibly like add, if you mentioned student council, maybe talk about the leadership aspect of it, but also how you're seeking to advocate for change. So you can talk about your role in school council and how once you become a dentist, you want to try and improve the system, make it more efficient, make sure patients are more comfortable when they're within that dental appointment. And you can maybe like dive into that side of things as well. That'd give you more material to talk about.
Okay, thanks.
Okay, we'll quickly go through the mark scheme for the past two questions. Okay. Is there no answers? Spade. Okay. I'll try and get the questions back, but if Yasmin, can you do the next questions? Let me try and find the answer to the previous one.
Yeah, of course. So, how will you prepare yourself for dental school and its workload? Does anyone want to have a go at this question? You can just put your hand up if you want to have a go, or just unmute and ask, or say in chat.
Hiya, could I answer this?
Yeah, of course.
Okay. So talking to a lot of dental students and a lot of dentists as well, talking to them made me aware, and they highlighted to me as well that dentistry, being a 5-year degree, of course, can be an incredibly mentally challenging and physically demanding um, degree. And they mentioned that sometimes the work can be a lot, especially like, during exam season, it can get overwhelming and that it can, um, you always get stressed during exams. That I think everyone can agree to that. And even, doing clinical works, like physically, it can be demanding sitting on those chairs with no back, and it can be straining physically as well. And with this, they also provided me with some, ideas, solutions, how they kind of work through it. But with me as well, for example, especially with exams, especially during GCSEs and A levels, being a gap year student, exams are a difficult time for me. And I think the thing that worked the best for me was, math.
Sorry, DT, you've cut off that, I think.
managing my time, prioritizing things that were important, creating
I think she's left the meeting. She might rejoin.
Oh, right, okay.
I'm just trying to fix the slides. Just give me 1 minute.
I'm so sorry. I think my Wi-Fi just cut me out.
Yeah, it's okay.
Could
Do
you
you
just
want
tell
to?
me where I cut off?
It was around, you said how exam time is hard, and then you're about to say how you cope with that.
Okay, so I think the thing that works with me best during exams is creating a timetable for myself, setting a specific time for each thing, whether it be a subject, a time for myself, or even when I go to bed, when I wake up. I think especially during exams, there's so many things going on. Creating a timetable was best for me to know what I'm gonna do at each point of the day, and I would definitely carry this on into dental school. Different making sure that I have time for exams, revising, but also, making sure that I have time to spend time with my friends and spend time with myself, chilling in my room and making sure that I have time to, just calm down and settle. And another thing that I would definitely do is also work with my peers. Something that works well with me is, working with other people, motivating each other. Because another thing with exams is that sometimes it can be very like difficult. Sometimes a specific topic can be really difficult for you to understand. So I feel like a study group is really good and it works well for me specifically. And making friends within the course and helping each other making revising fun. I think that would be a really good thing. And in terms of the physical challenges, I would definitely, keep my health up, going to the gym, things like that, and making sure that if there is a point during the day that I can't, I need a break, I would definitely listen to myself and listen to that and, take a break and making sure that, I don't burn out. Because at the end of the day, if I burn out, it's not just me at harm, but it's also the patient, and that putting the patient's interest first is important, but putting my physical health is also incredibly important. But yeah.
Amazing. That was a really good answer. Should I give the feedback now?
I think I've got the. Yeah, you can give the feedback, then I can go to the mark scheme.
Okay. So, yeah, it was really good. Basically a perfect answer. So I'll just say like what was good. So it's good how you showed insight and like realistic idea, and you actually gave examples. It was really good how like the examples were varied. So you did one that was like to do with the exam stress, and then one to do with like physical stress, and then it's good how you linked it to patients at the end. That was really important. So yeah, really good.
Let me just quickly go through points that you've. Do you want to talk about those?
Yeah, of course. So, yeah, the first point is like show insight into how you know this. So, Aditi did this really well. So, for example, you can say by talking to dental students, and and then if here put like that the workload isn't not the only challenge that you'll face. So, there's other ones. So, difficult patients, complaints, like you mentioned, like the physical challenges on your back and your mental health. So, yeah, that was really good. And then you've got this is Newcastle specific, so you can tailor this to the uni you apply to, but this is for Newcastle. So, and this is on independent learning that is goes along with the workload. So, how might this change how you manage the workload? And you can use a hobby to help aid how you have independent learning and demonstrate that. And that is important because dentistry requires you to independently learn and do that CPD. And then you did this really well. So explain how you cope with it via organization and time management. So explain how you do it currently and if you would keep this or what you would change in dental school. So it's good how you said you would continue this throughout dental school. So that was really good. and then link to dentistry. So here we've put you need to be able to keep up with the workload so that you have the required knowledge and skill to treat patients safely and improve their oral health and quality of life. And then your point was equally as good. So you obviously don't want to burn out from this workload. So making sure that your mental health is good throughout. So yeah, really good.
If one question that was in the chat, does the teaching style at Newcastle fit one of these three: problem-based learning, traditional, and integrated? I'd definitely say it's traditional, much more similar to traditional, with lots of clinical practice because you're overloaded with lectures. And I think me and Yasmin know we're lots like very behind on content, even after like term one. So it's lots and lots of lectures trying to make sure that you're at university at least 3 hours a day, no matter like what time of the year it is. They're always trying to make sure it's like you're getting the good education, and then you try and make sure you cover that up with like personal independent learning as well. Yeah, I'll quickly go through the mark scheme for the previous questions. I'm not sure why we couldn't see them. Okay, so there's two questions. First question was regarding what would you do if you get rejected. So obviously, talk about the initial sadness, talk about how you would do this process of reflective thinking, think about which weaknesses were, and make sure you plan out the whole year, the gap year, because you don't want to go into that gap year unplanned, and that make you seem confused and like unsure. So make sure it's really planned and to make like maximize the productiveness and always be resilient, have a positive mindset, and always have a long-term vision. And then for the question, I think was regarding, 1 second. Previous question was regarding work-life balance and the hobbies. So obviously, just following the STAR technique, identify the hobby, try and get the skills gained from the hobbies, maybe talk about personal development, talk about perspective and empathy, talk about learning and adaptability, talk about stress management, and then finally, always link back to dentistry and how it can be transferable within your future life as a dentist. Okay, I think we do have a couple of more questions. Yasmin, would you like to have?
Okay, so how do you cope with stress? Who wants to have a go at this question? Again, just put your hand up or unmute or put in the chat.
I have a go.
Yeah, of course. Do you want to put your camera on if you feel comfortable?
Not right now.
Okay, it's fine.
Sorry. Okay, so I cope with stress by breaking challenges down into manageable steps or seeking help when needed. But sometimes I think the best approach is stepping back when things feel overwhelming to like gain a new, like fresh perspective. And a clear example of this was during my EPQ, where I designed a PPG device to measure blood flow in the dental pulp. I started with zero electronics knowledge, which was really, really intimidating. And partway through, I accidentally blew up my circuit. And on top of all of that, there were some pieces of equipment that were delayed and didn't arrive on time. And that put me at risk of not submitting my EPQ on time. Initially it was very, very stressful, but I focused on what I could control. First, I broke the problem down into smaller steps. And when I blew up my circuit, luckily I had some spare components and I researched like basics carefully. And when I blew up, I didn't understand why I did that. So I sought guidance and help from a professor and a research associate at the University of Cambridge, and who really, really helped me find out where I went wrong. And when I felt myself like getting overwhelmed, I deliberately took the step back, like taking a walk around the park or shifting my focus to something else. And that allowed me to return with like a clear perspective and like a fresh mind. And by combining that planning and seeking help and like giving myself spaces to think, I managed to complete the project successfully and I submitted it on time. And that taught me to stay calm under pressure, problem solve, and prioritize tasks and reflect. And all these skills are really, really important in dentistry as there are often high pressure scenarios.
Amazing.
Should I?
So that was a really good answer. And like I really like how you based it around an example and then use that to structure your points that you step back, you plan, you ask for help, and you kind of do things to relax. So like take a walk and stuff. And really good that like you show that you would get help because sometimes a lot of like medical professionals, dental students like are reluctant to seek help. So that you showing that you aren't afraid to ask for help and when you need it is a really good trait. So yeah, Hassan, any thoughts?
I think everything is pretty good. The example is really well developed. You talked about how you dodged the obstacles and tried to come back from it. One thing, this general tip, not specifically, but acknowledge that stress is part of daily life and everyone will face stress at some point and dealing with it is really important and like learning how to deal with it is really important and how it's going to be like link it back to dentistry. I think that's yeah, that was a really good answer. One follow-up question that they might ask you is what do you think is the most important skill within dentistry and how have you developed this throughout A levels? So this is something that you can think about, but yeah, just try and make sure that you think of all the different personal qualities that a dentist might possess and try and link it to all your personal experiences, just to make sure that like you have this whole bank of answers and you can like pick and choose from it when they ask you a question, because it's very repetitive in what they ask within dental interviews.
Okay, so now we've got this question. Why is prevention important in dentistry? Would anyone like to have a go? Again, just put your hand up, put in chat, or yeah, Emily, would you like to have a go at this one?
Yeah.
Amazing. Do you want to put your camera on if you feel
No, thanks.
okay?
I think prevention's important in dentistry because it's a really key role that dentists play in the community. Because especially when it comes to government funded system, public health systems like the NHS, it's important that we try and prevent problems worsening because not everyone is going to be able to afford to see the dentist on a regular basis. So if you're able to stop problems arising that require complex dental treatments, it might encourage people to come to the dentist more often, knowing that they're not going to have to pay for such complex treatments. And as part of prevention, I think education is really key. So by educating, for that example, like school toothbrushing schemes, so people understand the importance of preventative care in dentistry and how if you don't maintain and uphold your oral health, it can lead to worse problems down the line. And I think an example of how you can do this as a dental student would be trying to get involved in community outreach work and helping getting involved in the community. And this is really important because as part of a dentist, you don't just treat your patient, you have to try and get involved and help the whole community. So I think that's something that's really important in dentistry as well. And I think it's important that you work towards prevention because I think prevention is like the main step in dentistry because if people are able to understand the importance of oral health care, then they're less likely to develop diseases further down the line.
Amazing. That was a really good answer and really good how like you defined prevention at the start and gave really specific examples and like how you would actually do that in real life. So like the outreach and the toothbrushing. So yeah, that was really good. Something that you could add is link it to work experience. So maybe how did you see the dentist use prevention in his everyday checkups or just throughout the procedures? And that can be something that can show that you've actually seen it in action, if that makes sense.
Yeah, thank you.
It's okay.
One thing that I'd like to add is try and memorize a couple of facts and figures regarding prevention, because it's really important to like you understand. Even like you can try and in your spare time go onto Google and think about the different oral health trends within the Newcastle area and the Northumbria area, so you can like really focus on the local needs of the population and try and understand where the weaknesses are. So once you do become a dental student, hopefully you can try and tackle those problems as a dental student.
Okay, thanks.
Okay, I think to finish off, we're going to have some final tips and then a Q&A at the end. So one thing that I would like to really emphasize on is follow all the social media pages from now on. They do post lots of things and like these like small things you can mention within your interview to show your like real interest within Newcastle at the university and the School of Dental Sciences. Uh, Break down the question. So when the interviewer is asking me the question, try and really find out what they're trying to assess. They might word it in a way that you can't understand at all, but they're always trying to either assess your personal qualities, trying to assess your situational judgment thinking and like how you deal with process, or your knowledge on hot topics. So it's like only one of those three things. So try and break it down and find out what they're trying to test, and then answer it accordingly. Then make sure you structure your answers. Be confident in when you speak, always trying to make sure you smile and then annotate your personal statement. I think Yasmin, you could elaborate a bit on that.
Yeah, so they can ask you questions based on your personal statement. So make sure that you have something to say that you can elaborate and talk about every single thing that you've mentioned in your personal statement. So yeah.
I think now we have Q&A, so whoever wants to ask questions either in the chat, I've been answering them. Otherwise, you can raise your hands and we can take questions. Yeah, Zach, go on.
I was going to ask, because Newcastle's only 20 minutes panel, should we like
Yeah.
prepare like 2 to 3 minute answers compared to like 5 or 6 for other unis?
That's a good question. I think with panel, it's all about making it as conversational as possible. Okay. With MMIs, you have limited, like you have a fixed time and you're going to try and put out as much information. With panel, you want to try and build that rapport. So don't force it as if like you're just speaking for too long. So yeah, try and keep it conversational. So don't like extend it too long, maybe like 2, 3 minutes, but try and make sure you cover all the information. Don't sacrifice like the points you want to make just because you think you're going to go over time.
Right. And also I was going to ask, do you think are role players likely for Newcastle because it's a panel?
I don't think they might have a role play, they might not. Personally, I did not have a role play. Yasmin, did you have a role play?
No, but it could be like because panel's quite hard to do a role play, so it could be instead, it's not from experience, but just like potential. It could be like they give you a scenario and it's more about what would you do instead of a role play, if that
Yeah.
makes sense.
So they might have situational judgment type questions where they're like trying to test your knowledge of handling situations. Even if they do have a role play, what they'll do is they'll put you into a position of a volunteer and they'll ask you to try and converse with a patient who's not opening up. So all you need to do is give the patients time, space, let them speak, okay, and try and ask open-ended questions. And you don't want to stay within your boundaries as a student.
Okay, thank you.
Yeah, no worries. Someone has their hand raised up. You can ask a question.
So I was going to ask, how do you know when to stop talking? Or do
That's a
you
good
just not
question.
stop and you'll be told to stop?
I mean, ideally, don't speak for more than 3.5 minutes. You should have a feeling, like you should be practicing so much, you should have a feeling of, when to stop. And the questions are very repetitive. So once you get a hang of it, it's like you have got instinct, okay, I've covered all the points. I don't think after this I'm just gonna be waffling. There's no point. Um, but do don't try and like obviously waffle, but try and make sure you cover all the points. There's no like good one way to like answer that question. Not
Would
sure,
you
Yasmin.
be, oh,
Sorry,
sorry.
carry on.
I was just going to ask, if you're going over the time limit, would you be told to stop talking?
So
It
there's no
depends.
like time limit, if that makes sense. But if they feel like maybe they've heard what they wanted to hear from you, they'll might just ask you a question and kind of cut you off and like help guide the conversation, if that makes sense.
Yeah. So it's a lot to do with just your own, your own perception of when to stop rather than waiting for someone else to tell you.
Yes, but you also don't want to speak for too long so that you're not able to answer all the questions. I think the panel would be really like they're going to be very friendly and conversational. They'd probably like let you know once you've done the time, like when you've spoken for long enough. But ideally, try and stick to 2, 3 minutes maximum. You don't want to be speaking for more than that.
Okay, thank you.
No
So going
problem.
from the chat, we've got some questions about like the types of questions. We can't really say because it's kind of against the rules, but
However, like we've talked about like the different questions that might have come up during our slides, so that might be a good place to start. say.
And if you look on the website, we put it in at the start as well, like what they're assessing you on. If you take that and then you write your own questions, maybe based on those points that they've said that they're assessing you on, it can be a good way to practice because then you're actually practicing based on the skills that they want to assess you on, if that makes sense.
Okay. We've got a question about curveball question. I personally did not have any curveball questions, but I've heard sometimes they might, at the end, once they're really impressed with you, they might ask you a question just to like test you. But it's usually going to be about the NHS and how dentistry works within that. So make sure you have like the basic knowledge and you're able to like speak on it confidently. Main thing with interviews is that you're able to get the message across in a structured and confident manner. Okay, the content itself is not as important. It is important to some extent, but the way you communicate the answer is like the key thing.
Someone's
I've,
asked if it's okay to bring their EPQ in, and I think that's a really good idea to do that because it shows that you have an interest in research, especially if it was dentistry related, then that can be
yeah,
something to talk about. And yeah, you can link it to the research going on at Newcastle and if it's something that you'd want to get involved in the future. So that's a really good point to make.
just to add on to that with EPQ, if you do mention it, always try and make sure you link it to a personal quality and how you've improved, how that's made you a better person, a better dental student, and always link it back to dentistry. Because there's no point in mentioning anything that's not going to be useful in reflection. So whatever you mention, you should be able to reflect it. If you can't reflect on it, don't mention it.
Uh,
Um, you can, I'll try and find stats for the success rate. I need to
it'll
remember
be
them
in
one.
the OJAS's MyUCAT guide, probably.
Yeah.
And SI, if you want to say your question.
So I have another question. So would you say that the panel interview is more difficult than an MMI interview? And also, would you say online interviews are more difficult than in-person ones?
So I think it just depends on yourself and kind of what you like. So for me personally, I prefer panel because you get to kind of build a relationship with the interviewers and you get that conversation for a longer period of time. Other people might like MMI more because you get a fresh start every 5 minutes, and it means that if one station goes bad, you can kind of reflect and restart over, if that makes sense. And then on online versus in person, again, it just depends on yourself. So if you get quite nervous, maybe online, you'll like it more if you're at home and you're kind of in your comfort of your own home. In person, maybe if you get motivated by seeing other people and kind of being in that situation, it'll be better for you. But it's more of like a personal thing, if that makes sense.
Yeah, I'd say the same thing as well. I like both. They're both good in their own ways. With MMI, if you memorize a couple of things, you can repeat it in every station and the interviewer won't know. Okay, that's a good advantage. With panel, you can show yourself much more. You can like build that rapport. And I think it's not difficulty wise, there's nothing different. It's just about trying to make sure you're adaptable to the situation and and take your time with panel. You've got so much time. With MMI, there's a bit more rushed, but like take your time with panel and let it flow naturally.
Yeah. Aisha,
Uh,
did you have your hand up or did we answer your question?
I was going to ask, also I joined late, so apologies if this has already been answered.
And it's okay.
If you're given a question that asks you to look into the different barriers to access, and because I was given a question where they'd listed like all the protected characteristics and asked me to like refer to each one and explain how those can affect someone's barriers to access. How would I structure that kind of question and what should I choose out of the like options to address?
can I answer that? Okay. So I had something similar at my Manchester medicine interview, actually. They talked about protected characteristics. Best way to answer that is try and group them together. So try and have a look at the protected characteristics, group them together, some things that are similar, and how in similar way you'd face those barriers. And like for example, you can link maybe age, race, sex as a group and how that's going to impact the patient whilst they're being treated. Okay, then you can maybe talk about the socioeconomic status, how that's something where it's difficult for them to access before coming into the like before coming into the dentist and like grouping them together and trying to categorize them that way. Does that make sense?
Yeah, I was also going to ask, if you're given Um, my question just completely blanked my mind. What was I going to ask? If you're given an ethics question if you're given a graph question and they show you some kind of trend and it's not something, so I'm a dental applicant, but if they give you a question that's not dentistry related, and I remember once I was doing a mock MMI and they gave me a question about the impact of cardiovascular disease on different age groups and then asked me why that would be the case, is that something I should prepare for, or am I not expected to know that?
Sorry, can you repeat the question? Yeah, it's just the end bit. So talk about graphs and cardiovascular disease. Can you just repeat what you mentioned?
Yeah, so I was saying that
there is nothing to repeat.
oh,
Sorry. Yeah.
I was saying that I had a mock MMI that showed the relationship between cardiovascular disease and different age groups.
Okay.
And I'm a dental applicant, not a medical applicant, so I wasn't ready for that kind of question. But they were asking me, the interviewer had a really firm focus on why is that the case and why would different ages suffer from different cardiovascular diseases. And is that just an off question, or am I meant to prepare for that?
I doubt they're gonna force you, they're not gonna ask you those types of questions within dental interviews these days. I've had that similar situation within mocks as well, where they try and throw you off with those types of questions. As long as you can make logical extractions from the graph, talk about the trends, and you don't need to go too deep into science. Maybe just use your A-level biology knowledge and try and think of things that I doubt they're gonna actually ask you that type of question. So I wouldn't worry about it.
Okay, thank you.
Okay, we've got a couple of questions in the chat. So do they ask you a lot about personal statement? I don't think they say they don't look at the personal statement, but sometimes they might actually do because it's a panel interview. They have more time to spend, so they might ask. It might be one question about a different experience, certain experience, and they might extract a personal quality and ask you to reflect on it further. So we've got a question. If they give us data interpretation question, how would they show us the graph? They usually share their screen. But I've never known Newcastle to actually do a data interpretation station. They're usually just more on communication, ethics, situational judgment, and personal qualities. Should we expect a manual dexterity task in online interviews? It's died down now. I remember Plymouth and Bristol did it last year, and no one else does try and do it. But it depends. It's more of an in-person thing. I know Dundee did one this year, but Newcastle, I don't think they do origami. And yes, the partner's post-interview offer rate is slightly higher. I think it's about 50%, whereas the normal one is 40. Is that all the questions?
If anyone has any other questions, you can post them on the group chat and we'll send the slides as well.
Yeah.
Oh yeah, iPhone, you can ask your question.
Main hot topics for this year. Sorry, who said that they'll ask your hot topic? Is it mentioned within the Newcastle interview information? Okay. Can you think of any, Yasmin? I've got a
Maybe
couple in
the
mind.
reform of the dental contract. That's quite a current one. Maybe the phase out of amalgam as well, quite current.
Yes.
And a lot of things in the news on DIY dentistry and people kind of doing dental treatment not in the dental clinic and they're not dental professionals, so something that could be asked. And then your basic ones, so water fluoridation, sugar tax, dental tourism are all common ones, I guess. Yeah.
I think one more thing that's been recently been being discussed within the higher levels is whether dentists who graduate within the UK have to work in the NHS for 3 years, like a minimum 3 years before they can actually leave to try and make sure you maintain the like number of dentists within the UK. So that might be possibly like a discussion topic where they talk about commitment to the NHS and like they might bring in private dentistry within it.
Yeah, that's a really good one. I really recommend you guys research like the reform of the contract because it has like a lot of these things
Yeah.
in it and that you can talk about as well. Yeah, so the DentSoc has their own football team, if I'm
Yes, it's called Axe Wielding Baboons. But yeah, they play I think every week. It's in within the university. So they just play in leagues and they have socials and everything. But there is a football team, there's I believe a netball team as well.
yeah.
Yeah, we have different events. Like I think last week we had a chai sock meeting. That was quite good. But then Dent Socks is quite active. There's dental ball as well coming up. So it's yeah, they have lots of events going on. SI, you have a question?
This is another question. So, would you say it's important to, would you say, how do I word this? Would you say the content of what you're saying is more important than how you present it? For example, would you get more points or look better if you seem very confident and you're smiling a lot?
Yeah.
Or
Okay. I'd say personally, I've always felt like the way you convey your answer is way more important because you can have someone who learns the whole history of dentistry for the past like 10 years and blurt out in an interview. Okay, that's not showing good communication skills. The main thing they're looking for is how you communicate with other people because within dentistry, you're going to be around people. So trying to smile all the time, trying to be confident within your answer, don't always like think about your answer too long, or don't like basically you're confident in what you say and you structure it really well, so you have a logical thinking pattern. I think that's the best way to try and um, go about it. So definitely the way you structure is much more weighted than the content. Obviously, knowing basic content is important. So having the basic knowledge, being able to extract that and like put that into answers, but the way you convey your answer is best thing.
thank you.
What is the best way to end an answer to avoid awkward silence? It depends what type of question it is. If it's like it's most likely going to be ethical question or like a situational judgment question where you don't know what else to say. Just try and summarize and try and make sure you reflect and link it to dentistry instead of ending in silence and saying, yeah, that's all I can think of. Does that make sense, iPhone?
To compare NHS and private dentistry, I think it's good to, if you first define NHS dentistry and say like what it is, who it's free for, and then give the pros of NHS dentistry, the cons of it, the pros of private, the cons of private, and then give a conclusion kind of saying how we obviously need both and they're both important and you do need to know about UDA and band payments.
One thing I'll send a link to is a small Notion page I made which has a couple of like hot topics. You might find it useful. So I'll put that in the chat and then you can request access to it and then I'll provide that access. So that might be useful. Let me just try and find it. And then yeah.
Yeah, so Emily, for every uni, I think it's a good idea if you have a why this uni answer ready because it could be a potential question for any uni.
I think we can stay here till 7:30 and then we can end the meeting if anyone has any other questions left. For the BDS course, how is the student diversity? I'd say it's about 50-50. Because of partners, it's quite mixed. But I'd say yeah, it's quite diverse, in my opinion. It's a very good mix. Yasmin, do you want to answer the question in the chat?
Okay, so Ian's asked, should we focus on like personal attributes and stuff about dentistry rather than role plays and SGT? I'd say definitely focus on personal attributes because if you look in what we showed you, kind of what they're assessing you, a lot of those are personal attributes. So it shows that they kind of have an emphasis on that, but don't neglect role plays and SGT because it could just as equally come up. Yeah, we'll
Yes,
share that.
I'd try and ask Ojas to either put a link on, try and put it onto the dental interview program or dental group chat. But yeah.
So for good things to say about Newcastle and why Newcastle location in uni, it will be the same stuff that we covered today in the slides. So we had a slide for the course and then a slide for the uni and the city. So yeah.
I'll put in let me know if that link works. I've put a page that should go to my Notion. But yeah, you can request access and I'll approve that. Okay. We've got a question on what are some good things to say about Newcastle for why Newcastle. So I think we've covered it in the slides. Yasmin, do you want to quickly go over it?
Yeah, sure. So for why Newcastle, the course itself,
Should I
for
go
why,
back on the slides?
yeah, sure.
That'd be easier.
So definitely talk about the new simulation units, the digital equipment, talk about how it's like quite independent learning and how that works for you. Yeah, so here we've got early clinical exposure and then a lot of personal professional development throughout the um, years. And then you get to work alongside other professionals, so other nurses, other dentists and stuff, because it's integrated with the dental hospital. And then in terms of the uni itself, so a lot of societies, I mentioned before, it's good if you pick one volunteering one sports one, and one interests one to show that you kind of have those and then like give back to community, maintain your physical health, and then meet new people. And then in terms of the city, it's friendly, it's affordable, it's diverse, and you've got a lot of culture. So, if, for example, if you're a fan of football, you've got Newcastle United football, and then nature, it's quite close to the countryside. So, yeah.
That's good. That's a good point about Newcastle United. They have Champions League nights as well. That's quite fun. I think there's a game like in half an hour as well. So I'm excited to watch that. Yeah. Emily, we'll be sharing the slides. I'll ask her just to share them onto the big group chat, so then you could try and go through it. And then I think there'll be a recording on YouTube, possibly. I'm not sure if this session's been recorded. Yasmin, how did you feel after your interview? Did you feel you were good enough to secure the offer? Be more anxious?
So, after my interview, I didn't really think that it went well at all. Like, just because of the way that I said my answers, I didn't think that I structured them the way that I did when practicing, just because of nerves. But I think my why Newcastle answer was quite strong and just like the way that I presented myself and communicated, and that maybe is why I got the offer, even though I felt like I didn't maybe talk about everything that I wanted to talk about.
Okay. If we live here, how would you bring up how would you bring that up without seeming like it's the reason why you applied in the first place? Yasmin, I think you would know because you live in Newcastle.
Yeah, so I live in Newcastle, and the way I incorporated it into my answer is by saying that because dentistry is so, this is like an example, and because dentistry is so stressful and like emotionally demanding, especially like the course and the workload, because you're so close to home and you have that support system here, it makes it a lot easier, like the transition into uni, and like it means that you always have people to talk to, your friends, your family. So, yeah that can be the way you integrate it into your answer.
Okay. So for why Newcastle, should we include maybe 1 to 2 potential cons So research. Yeah, you could possibly mention cons, but always try and make sure you have a backup reason on how you can maybe improve those cons or how those cons won't affect you as much. It might be like a general public like perception, but that's not going to bother you too much or something like. Just don't make it seem like Newcastle's a bad city. Don't want to put a bad impression.
Yeah, I'd say maybe stay away from the cons because
Yeah.
you want to focus more on the pros because they want to know that you'll definitely choose this uni and you definitely want to come here and stay here and love it when you do.
I'm not sure why loads of people are joining right now. There might be another meeting scheduled, but we've got like 30 people joined. Is everyone here for the Newcastle interview session, or is it? Oh, QMUL. What time? What time does it start? Now, okay.
Okay,
I
cool.
think we'll leave. Everyone who's part of the Newcastle Dentistry can leave. We'll share the slides, and hopefully you guys find my Notion page useful. Let me know how it is.
Thanks,
Okay.
guys, and good
Thank you
luck.
very much. Best of luck with your interviews.